Hello everyone and welcome. I welcome you guys to this short video on a common health challenge faced by many, and that health challenge is asthma. Asthma is a common inflammatory disease causing the narrowing of the airways or the bronchioles in the lungs, which severely impairs breathing. This leaves the lungs impaired to gas exchange involving oxygen. It's estimated that 3 million Canadians have been diagnosed with asthma, with 600,000 being children. Asthma attacks can be triggered by a number of things. Some of the most common reasons include upper respiratory infections such as the cold or flu, noxious substances, tartazines, sulfates, non-steroidal anti-inflammatory drugs, beta blockers, anxiety, dust, pollen, and smoke. Looking forward, we will look at a case study involving a patient with asthma. The nurse will review the patient's MAR and will demonstrate the proper protocols and procedures involving the assessment and care of a patient with asthma. While the assessment progresses, the nurse will demonstrate Caritas processes by being authentically present to the patient's needs, listening to her expression of feelings, both negative and positive, and engaging in a transpersonal learning teaching experience, the facilitation of the therapeutic relationship.
Hi, I'm here for a report on room 1A.
Okay, so the patient is 28 years old.
Okay.
He has a history of asthma, but doesn't give him any regular problems. He doesn't use an inhaler every day or anything. He has no recent history of an attack. He slept well through the night, responsive. He does have wheezing and crackling bilaterally in his lungs, which we expect with the influenza. But other than that, he pretty much does his own thing. We're giving him Tylenol for the pain and the fever. And because he's NSA tolerant, it's okay for him to have the Tylenol despite him being asthmatic. So other than that, he's all right.
Okay. All right, so I'm just going to check the MAR. Let's see. First things first, I'm going to just write down his unique identifier number. So that's 1, 2, 3, 4, 5. All right, so I'm noting that he is currently taking Ventolin, and that's his rescue inhaler, and it is as needed. He's on acetaminophen, which is also on an as needed basis, and that is it for the MAR. Let's check the lab values. Okay, right here. So I'm noticing that his leukocytes are pretty high, and his neutrophils are pretty high, so I'm going to really be aware of that.
Of course, before the nurse enters the patient's room, she will make sure to adequately yet thoroughly wash her hands, and she will follow proper clean technique. This will promote patient safety and safety of the other healthcare professionals.
I'm ready to go into the room and assess this patient. Hello. All right, so I would first do my environmental scan. I'm noticing that there is oxygen available, hooked up, and there's suction equipment. I'm noticing that the bed is in its lowest position, bed rails are up, and the call bell is within reach. All right. So, hello.
Hello.
How are you today?
I'm not well.
Okay, I just want to let you know who I am. My name is Chelsea. I'm a year 2 nursing student, and I'll be taking care of you today. What is your name?
My name's Michael.
Michael? Okay, Michael. Just give me a second. I'm just going to open this up a bit. Get some light in there. All right. All right. May I check your armband as well? Excellent. And your unique identifier number matches up. Excellent. Okay, so just to let you know, I'll be doing some electronic documentation.
Alright.
So you know, all right. So what brought you in today?
I'm pretty sick.
Can you just say that one more time? Sorry.
I'm pretty sick.
Okay. So do you mind if I ask you a few questions?
Not at all.
Okay. So, what brought you in today?
I'm sick.
And when do you feel the pain?
My head hurts. And it hurts from a cough. Got a headache.
Can you describe the pain in words?
throbbing in my head and scratching in my throat.
Throbbing in your head and scratching your throat. Okay. Does it radiate anywhere?
No.
No, it doesn't move anywhere else? Okay. On a scale of 1 to 10, starting with just your head, 1 being no pain at all, 10 being the worst pain you've ever felt, can you rate the pain?
No, I'd say it's about a 7.
About a 7, okay. And what about your chest, 1 to 10?
Probably about a 7 as well when I cough.
Okay. And is there a time when the pain gets worse? Like what time of day?
When I get up, it's real bad.
In the morning? Okay. And what makes it better?
Medication.
And so what do you think is causing this pain?
My sickness, my illness, flu or something.
Okay. So just to let you know, I took a set of vitals and brought that in here with me. All right, so your temperature is at a 38, which is above normal range. Your pulse is at 110 beats per minute, which is above the normal range as well. Normal range is between 60 to 100. Your heart rate is in regular rhythm, which is good. And your blood pressure is 118 over 74. And your O2 sat is 95% on room air. You're not hooked up to any oxygen, so that's good. Respirations are 18 beats per minute, so that's good. That's within normal range. All right, so I'm noticing, before I want to continue with an assessment, I'm noticing there's no cyanosis, there is some pallor in your face, and you are a little diaphoretic, meaning that you're sweating. Good. All right, so do you mind if I continue with my assessment?
No.
Okay, I'm just going to raise up the bed to work to a workable height.
Okay.
And how does that feel?
Oh, that's pretty good.
Good? Okay, excellent. All right. So I'm just going to give us some privacy and then we'll take it down, okay? Excellent. So right away, I'm doing just an inspection of your upper chest. I'm noticing that there's no cyanosis or pallor in the skin. It is dry and intact. Your ribs are sloping downward and are symmetrical and in elliptical shape. Your trachea is midline and there's no indrawing of the trachea. Your costal angle is 90 degrees and you're breathing quite not as normal as I'd like. I notice you're using some accessory muscles. Okay. So now what I'm going to do is palpate your chest. Just let me know if you feel any pain in any of these regions, okay? So just a light palpation. Any pain at all? No? Okay, excellent. All right, so now I'm just going to listen to your lungs. Can you take some deep breaths as I go along? Okay, it's going to be in and out. All right, deep breath in. And in.
While the nurse auscultates the patient's lungs, she will make sure to landmark these spots.
I'm just going to check the lateral portion of your lungs, okay?
The nurse will now auscultate the side portions of the patient's lungs. This will guarantee a thorough understanding of the patient's respiratory assessment.
Okay. So now I'm just going to check the posterior part of your chest, meaning the back, okay? Thank you. Just bring this up for you. Come on, put your down. I'll come right for you, okay? All right, so I would inspect the posterior part of the chest. I'm noticing that there's no cyanosis, pallor of the skin. It's dry and intact, and the spinous process is straight and midline. Okay, so now I'm just going to palpate you. Let me know if you feel any pain anywhere here, okay? And any pain? No? Okay, so now I'm just going to listen to your lungs, okay?
Okay.
And breathe in.
Just as the nurse auscultated the front portion of the lungs, the nurse will follow these landmarks to auscultate the posterior portion of the lungs. This will guarantee the most fullest assessment of the respiratory system.
And last time in and out. Okay. Thank you very much, Michael. So what I do notice is that there's some adventitious sounds present in your lungs. What that means is I'm hearing some sort of crackles and wheezes, so it just doesn't sound like clear air and airway entry. Okay, so what we're going to do, let me just document that. All right, so I'm done with my assessment for now. I'm going to lower your bed. Your call bell is within reach. And is there anything that you need at the moment?
Well, my head hurts, so some Tylenol would be nice.
Some Tylenol? Okay. Okay, so you're okay with being like that? All right, so I'll be right back with your meds and I'll be right back.
In between seeing patients, the nurse will always use hand sanitizer to sanitize their hands. This will promote safety to the patients and the other healthcare providers.
Okay, so I'm just going to review the MAR again. I've done my critical thinking skills on the medication that I will be administering, which is acetaminophen. I did my 8 rights check. All right, so I'm going to locate the medication. And there we go. I'm ready to go in.
Little did the nurse know, while she was preparing the medication, her patient went into an asthma attack.
Just take some deep breaths. I'm just going to raise the head of the bed again. Okay. And just check the O2 sat as well. Okay. Keep breathing in. Oh, excellent. Oh wow, your O2 sat's at 88%. Okay.
After the asthma attack, the nurse will stay with the patient for the next 5 minutes and reassess his O2 sat.
Okay, Michael, I'm noticing that your O2 sat is 95% now, so that's very, very good. It's showing that the medication was effective. I'm going to give you your pain medication now. Is that okay?
Yeah.
Okay. So here you go. Excellent. All right, Michael. So, if you don't mind, I'd like to just educate you a little bit on managing your asthma symptoms.
Okay.
Is that okay? All right. So I just want you to practice deep breathing, cough, so you can really open up those lungs. Pursed lip breathing is very important, so it mimics. Excellent. And I'd highly encourage you to follow what the physician ordered, to take your puffer as needed, but we'll follow exactly how the doctor stated. I will mention to the physician about my findings, and I'll be talking to my clinical instructor as well to clarify what just happened, okay?
All right.
And is there anything else that you need from me, or anything else, any questions you have?
No, okay, thank you.
You're okay? All right. Well, yes, it was nice seeing you. I will come back to check up on you and take another set of vitals just to make sure you're feeling all right, okay? I'm just going to lower the bed to the lowest position, and would you prefer the head to be up?
I'm good sitting.
You're good sitting? Okay, so let me just make sure you're safe. Excellent. Would you like some privacy as well?
Yes.
Okay. All right, Michael. We'll see you soon.